Degenerative arthritis, causes and prevention. Arthritis is an umbrella term for diseases that affect a person's joints. Degenerative arthritis, also known as osteoarthritis, is a form of arthritis that develops due to aging or overuse. Degenerative arthritis is the most common form of arthritis in the United States, where more than 32.5 million adults are living with the condition. It is sometimes known as the wear and tear form of arthritis, as it often occurs due to the natural aging process. It can also develop as a result of an injury or the overuse of a particular joint. In this video, we look at the causes, risk factors, symptoms, diagnosis of degenerative arthritis. Symptoms of degenerative arthritis. The symptoms of degenerative arthritis vary depending on where in the body a person develops the disease. They usually get worse over time rather than occurring suddenly, except in the case of injuries. Regardless of which parts of the body the condition affects, common symptoms may include pain, often throbbing, dull aching, swelling, reduced flexibility, clicking or popping noises when a joint bends, stiffness, decreased range of motion. Typically, joint stiffness will present early in the morning or after periods of rest, and it will last for up to 30 minutes before loosening up again. The joint pain can either be predictable at low level, lasting for long periods, or take the form of intense, unpredictable bursts of pain. According to the National Institute of Arthritis and Musculoskeletal and Skin Diseases, the parts of the body that osteoarthritis most often affects include the fingers and thumbs, knees, hips, neck, lower back. As the condition progresses, people may find themselves unable to complete activities such as holding a coffee pot, going up steps, or walking long distances. Causes of degenerative arthritis. People develop degenerative arthritis when the joint cartilage between bones becomes damaged or breaks down. Often, the body activates a repair mechanism to attempt to remedy this damage. As part of this, bone spurs or osteophytes may grow within the joint at the end of the bone. This can then cause friction within the joint and lead to pain when the person uses it. Risk factors. Certain factors may increase a person's chance of developing degenerative arthritis. This include age. Symptoms generally appear in adults over the age of 50 years, although they can occur earlier. Sex. Females are more likely than males to develop osteoarthritis. Genetics. Osteoarthritis tends to run in families. Weight. Having obesity can increase a person's likelihood of developing osteoarthritis, as the additional weight can place extra stress on the joints. Overuse. Repetitively using the same joints, such as in sports or at work, can sometimes lead people to develop osteoarthritis. Some of these risk factors, such as weight, are modifiable, whereas a person cannot change others, such as age and genetics. Diagnosis of degenerative arthritis. There is no single test to confirm the diagnosis of degenerative arthritis. Instead, doctors will ask a series of questions about the person's medical history, such as when the pain began and whether they have sustained any injuries to the affected joint or joints. They may also want to know when the pain occurs and what if anything, makes it worse. In addition, the doctor can use x-rays to check for bone spurs or other types of bone damage. They may also take samples of fluid from the joints to rule out infection or gout and run blood tests to exclude other possible causes. Non-medical options. Maintaining a moderate weight can help remove the added stress that excess body weight can put on the joints. People can do this by following a nutritious, well-balanced diet and engaging in regular, low-impact physical activity. Hot and cold therapies may also help relieve pain and stiffness in the joints. People should alternate the application of hot and cold compresses to the areas over the affected joints. However, a person should always wrap an ice pack in a cloth first so that they are not applying it directly to their skin. Can people prevent degenerative arthritis? There is no way to prevent osteoarthritis completely. However, by managing the modifiable risk factors, people can lower their risk of developing osteoarthritis or stop it from progressive if they already have it. Other ways to minimize the chance of developing the condition include warming up before exercise, having a varied exercise schedule, resting after intense physical activity. When to contact a doctor? People should contact a doctor if they experience any of the symptoms associated with arthritis, such as joint pain, swelling, or stiffness around any of their joints. Although there is no cure for degenerative arthritis, by treating it as soon as possible, people can keep it under control and maximize their quality of life.